Hello, everyone. So, I'll be talking about the importance of perioperative usage of artificial tears in cataract surgery. We do not have any financial interest in the products mentioned in the presentation. So, we know that tear film plays a very important role in the quality of vision. So, after every blink, if the tear film is irregular, there is going to be a gradual increase in your optical aberrations. So, this automatically will decrease the optical quality of an individual. So, as cataract surgeons, why are we worried about this? Because dry eye is predominantly seen in middle aged people. And even after you give a premium IOL and you do a perfect cataract surgery, patients always come back to you saying they have foreign body sensation, irritation in the eye, or they're not very happy with the eyes. So, this could be because of the dry eyes. So, most of the time, we tend to neglect treating dry eye and take care only of choosing the IOL and taking care of that. But then later on, patients always come back complaining. So, what is the impact of cataract on dry eyes? So, usually, when you do a femto assisted surgery, also, the docking itself can cause loss of goblet cells and worsen the tear film. So, that also plays a very important risk factor in patients who already have dry eyes. So, along with this, if you do a cataract surgery with individuals who already have dry eyes, it can aggravate it. It can fluctuate your vision. There can be persistent epithelial defects, and it can also cause abnormal wound healing. So there is a recent article on Journal of Corneal Ocular Surface which says that for the kind of dry eye, say mild, moderate, severe, so in mild evaporative, what do we give? Aqueous deficient, what do we give? And accordingly, what medicine can be given for the kind of dry eye that is persistent. So what was the aim of our study was to compare the efficacy of perioperative versus postoperative use of advanced hydration therapy on ocular surface health in post cataract surgery patients. So the study was done at Narayan Netralaya. So we included all patients who were undergoing cataract surgery above the age of 45 years. We excluded patients who previously were diagnosed to have dry eyes or were if they were on long-term topical steroids. So we divided the groups into two groups. So 64 patients were divided into 32 each. The first group received advanced hydration 2 weeks before surgery and 4 weeks after surgery. So they used it for a duration of 6 weeks, whereas the second group used it only for the post surgery part, that is 4 weeks post surgery. So a detailed dry eye evaluation was done. Cataract surgery was performed, and we followed up these patients on post op day 1 and after 1 month and repeated all the tests again. So we know that the SPEED questionnaire, that is the standardized patient evaluation of dryness, is one of the common questionnaires that we use in evaluating what if the patient's feeling tired in the eye or any gritty sensation. So we score them accordingly. So what we came across, according to the Shermas and TBAT scores, there was an improvement in both the patients, in both the groups, perioperatively and postoperatively. There was a statistically significant improvement in both. But the group 1, which had used the advanced hydration for 6 weeks, showed a slightly better outcomes as compared to the other two groups. Even in the SPEED questionnaire, they were relatively better, both of them, but the group which had used the medicines 2 weeks before surgery had better outcomes. So, what was known was that dry eye disease may adversely affect the vision in post cataract surgery patients, and artificial tears containing both HB guar and hyaluronic acid may offer better benefits. But what the study adds is that giving this therapy preoperatively and postoperatively, can help reduce the symptoms of dry eye, and it can also improve the ocular surface health. So, to conclude, we found that the combination significantly improved the Shermer score and the TBAT in Group 1. Group 1 patients showed a statistically significant reduction in the frequency and severity of symptoms of dry eye disease as compared to the other group, which had used it just postoperatively. And the study also highlights the importance of proper preoperative evaluation and the use of appropriate treatment to ensure the best outcomes for our postoperative patients. Thank you.
Thank you, Dr. Tejal. It was a very nice talk, actually. We keep hearing every time most of the studies come out of for Indian ophthalmology is from Narayan Nethralaya. You have been doing a tremendous job. I think we are just last time I was part of the refractive meet there. Soon you are also going to get the kit where I think the you can really assess the type of the exact cause for the dry eye
Right.
process. As a clinician, like as a general practitioner, patient come to you. So patient come to you with a complaining of with a foreign body sensation. One criteria. Second one, I am having a severe burning sensation. Third one, I am having a very much tiredness. So, what kind of actual eye drops for a general practitioner, apart from all this evaluation done? All three categories also
Yes.
complaints are different, but you found out that they're having a dry eye.
Yes, sir.
So, what kind of combination of drops you prefer them?
So right now, advanced hydration is working very well for our patients, especially if they're undergoing cataract surgery,
Yeah.
because it has the combination of hyaluronic acid and HP guar, so it
Mm.
acts really well on these patients. But again, since we can assess the lipid layer and all of these, so there are
So, which
certain
is the brand
medicines.
name? I
This
don't.
is Alcon Sustain Hydration
Yeah, yeah. No, because I've been using that Alcon, one more brand called Systane Complete.
Complete.
Do you have
Yes.
any? What is the difference between Systane? I don't have any financial risk with this particular product. What is the difference between Systane Complete and Systane Hydration?
So both are equally good,
Hmm,
but Sustain Hydration also acts very well on the lipid layer. So
hmm.
it helps in
But what they
improving.
say that with the Systane Complete, it
It
can take
will.
care of everything.
Yes, sir. We
As a
tried.
general practitioner, love to put only Systane Complete because it should take about every factor in the eye.
Yes, sir. But we have used both Sustain Complete and hydration in our practice, and we found hydration to be slightly better in patients as compared to complete. So we found that hydration was slightly better.
Yeah. Thank you so much
Thank
for
you,
a
sir.
wonderful
It
talk.
was nice having you here, sir. Thank
Yeah,
you.
yeah.